My name is Devin Link, and I'm a public health educator at the Broome County Health Department, and I'm the communities coordinator under the Creating Healthy Schools and Communities grant, or CHSC. The Binghamton High School has been struggling with traffic flow and congestion for a really long time. The road is a two-way street, so when the buses stop, traffic stops. The street the school sits on wasn't made to handle such a large volume of student walkers, car pickups, and school buses, so dismissal time was very dangerous and teenagers were weaving in and out of vehicles. The county stop arm program, which catches drivers who illegally pass school buses, showed that this location had a very disproportionately high level of traffic violations. Because of this, community leaders approached CHSC in hopes of improving safety in the area. My colleague and I started with an on-site assessment and saw that there were two main problems. Cars were speeding and students were not crossing at the crosswalk at the corner. We even saw a crash between two students during the assessment. Everyone was okay, but it was really eye-opening. Around the same time, the school also hired a traffic and engineering firm to conduct a study. One simple solution was that our assessment and the study agreed with was that a raised crosswalk would help improve safety at the area. Raised crosswalks are traffic calming measures that allow pedestrians to cross the street at grade with the sidewalk instead of stepping down into the road. They improve safety by making pedestrians more visible to oncoming cars and also forcing the cars to slow down in the same way that a speed hump would. So we collaborated with the school, City of Binghamton, and local metropolitan planning organization to work on an implementation project. Through many emails, phone calls, and traffic board meetings, we decided to start with the temporary raised rubber crosswalk as a pilot project. After installation, I provided pedestrian education to the school along with their school resource officer. By going into their physical education classes, we were able to reach pretty much every student. And a lot has happened because of this temporary raised crosswalk. The school has reported that it's a night and day difference. Cars are driving slower, students have a safer place to cross, and dismissal is much more manageable. Even though the street still gets busy during dismissal time, cars don't tend to stop on the crosswalk, so students have a safe, designated place to cross. It was really promising to see such positive results coming from this pilot study. However, we also realized that it wasn't as accessible as we would have hoped. The raised crosswalk that was initially ordered didn't reach curb to curb, so users had to step down into the street and then back up to the crosswalk. Student users also reported that it was slippery when it rained, so they were less likely to use it during bad weather. Both of those factors can cause a challenge for people who use a wheelchair, have limited mobility, or have balance issues. Plus, because it was a temporary solution, the signage at the site did not follow the Federal Highway Administration's regulatory standards, which has the potential to cause confusion. But even with these challenges, the safety improvements made this CHSC-funded pilot project a success. And I'm excited to say that all of these concerns are being addressed in the next phase of this project. The City of Binghamton has decided to implement a more robust, raised permanent crosswalk at this location. The new permanent crosswalk will reach curb to curb, so pedestrians will remain at grade with the sidewalk while crossing the street. And it'll be made out of concrete or asphalt, so it won't get as slippery in the rain or snow. Plus, it'll be compliant with traffic safety standards. By installing the raised crosswalk, we were able to create a solution to a huge safety concern that wasn't properly addressed for years. And this is just one of the many projects that we've worked on under CHSC. Because of this grant, we've been able to improve the health and well-being of Broome and Tioga County residents.